when it comes to, for example, let's say viruses or cancers or even STDs, though, can those be reversed or healed or cured through stem cell research? So, as for example, let's say
Okay.
HIV or
Doctors are
also
really
cancer.
scared of those words when you start to use the word cure and heal. And but because why? Because that borders on making claims. So all the doctors are really afraid of
Mm,
making any claims when there's no FDA approval. So, but that aside, has there been evidence of stem cell therapy helping conditions like that? Yes, absolutely. There's one study I presented looking at treatment resistant HIV
Hmm.
patients,
okay.
and it even helped those people decrease viral load
Wow.
and yeah, doing a lot better. So yes, it can help people fight infections because it does help you help your immune system to be more robust. But also stem cells like these mesenchymal stem cells can actually secrete antimicrobial peptides, directly killing microbes. So all those are possible. Just one caveat: these mesenchymal stem cells have receptors that somehow the viruses can dock on. So this is very strange, right? Irony of nature. And they can even, not only they can be selectively destroyed by these viruses, but they can also become a site of reservoir. So they could be a place to harbor these microbes. So there's a double-edged sword. So for herpes
Mhm.
family viruses, that's more prominent. So that's something if a patient did not respond to stem cell therapy, that's a place to look into. Is there, do you harbor certain microbes that selectively attack the cells that I'm putting in your body? So that's just a side note.
Would they be, if they're harbored inside the body, would they be safe or would they have to be removed? Like, what would
Oh,
you do
we
in that
all have
situation?
microbes in our body, and it's a constant, battle. So do they need to be removed? It'd be nice if they're removed, but um, I doubt there's any human being that's free of pathogens in the body. Yeah, so it'd be nice to remove all of them,
Yeah.
but that could be a battle.
Okay, fair.
What about like
You could
conditions?
take antiviral treatments for sure, and then you can do all kinds of other. There's a lot of integrated medicine who are doing doing different attacks on these microbes or parasites. So there are ways to help reduce them. Yes.
Uh,
It's like you
I,
have an answer for everything, by the way. I just wanted to add that.
If you call those answers, I have a thought.
what are your thoughts on Alzheimer's then, and how can stem? Is there any evidence
Yeah,
for stem cell
Alzheimer's,
therapy?
there are different schools of thought as well. And there are people who do believe that there's huge viral origin of these neurodegenerative conditions, all of them. So if you attack these potential viral infections, you could relieve a lot of symptoms. So that's one thought. Of course, the other school of thought is that they're not mutually exclusive. So some people believe Alzheimer's is, type 3 diabetes. There are people who have said that. So it's a form of metabolic disease, inflammation, metabolic derangement in a sense that caused brain deterioration and inflammation. So then you need to look at how you can remove these type of metabolic disorders. Then that's the whole shebang of integrated medicine. So you need to look at your nutrition. Are you
Hmm.
getting adequate vitamins and minerals and antioxidants? You look at your hormone balance. You look at your microbiome. Do you have, you lack good bacteria that's supposed to help us thrive, and harbor bad ones that's causing you harm all the time? Do you, are you there are other, as far as energy, there are a lot of things. Are you getting enough sunlight? Are you grounding? Are you getting rid of your, as far as the discharging of the electrons, and all these are aspects of health that people have found tremendous help for, because one person may be doing grounding every day and all their problems went away. The other person, it may take hormone replacement. So I have to individualize to see what
Right.
each person, what they need. Yeah, that's the web, right? We're going to the web.
Hmm.
Where at what points on the web are there problems?